Obstructive sleep apnea is where the airway of a person is inhibited during sleep due to the tissues around the throat constricting. This can be a serious problem and lead to many other issues. Let's review some of them. When sleeping and laying horizontal, the airway gets pinched to a much smaller diameter than normal, sometimes completely stopping breathing. This causes the brain to have to wake the person up and out of a deep sleep to take a more forceful breath. This can happen many times a night, up into the hundreds of times. Not only does this mean that the person's oxygen level in their bloodstream decreases, but it also means that the sleep is disrupted. To learn if you have sleep apnea, a proper sleep study is recommended, but you might also be able to see the symptoms in everyday life. Typical symptoms include excessive sleepiness, loud snoring, and if your sleeping partner observes episodes where your breathing is stopped. Snoring doesn't automatically mean you have sleep apnea, but it is a risk factor. Sleep apnea also doesn't directly cause high blood pressure and excessive weight gain, but obesity is a risk factor for obstructive sleep apnea. Men are also more at risk for obstructive sleep apnea than females, and obesity is a huge factor in sleep apnea. If you feel you have risk factors or would like to discuss dental treatment options with your doctor, ask about taking a sleepiness test or to get a sleep study. Typical treatment options for sleep apnea include a CPAP device, but in the dental field, we have many different devices that can also help treat obstructive sleep apnea.